Jaimie Clayton joins us now on the show. She's the president and CEO for Oakland Family Services. Jaimie, it's always great to have you with us.
Hi, Ronnie. Thanks for having me back.
So I know it's been a couple months since we talked to you last. Give us an overview for those that aren't familiar with Oakland Family Services, because you do all offer so many different resources to our community.
Yeah, we're having our 100th anniversary this year, so we've been around a long time serving the community.
Congratulations.
Thank you very much. We're actually really proud of that. I think it says something for a nonprofit to still be here, not just after the pandemic, but after 100 years. And our mission really hasn't strayed that much over time. We're building brighter futures through prevention, education, and treatment. So through prevention, and it's good timing because this is Child Prevention Month, Abuse and Neglect Prevention Month. We prevent child abuse and neglect. We work to prevent trauma before it begins. So these are really our services aimed at 0 to 3-year-olds, 0 to 4 and 5 maybe, home-based parent support programs where we're really getting in and doing parent training and support, helping families. In education, we have 2 Great Start Readiness preschools. So those are preschools funded through the state of Michigan, specifically for 4-year-olds who are at risk of entering kindergarten not ready to learn. So those are risk factors: social emotional delays, developmental delays, parental issues that like lack of literacy or an incarcerated parent. And all of those children live far below the poverty line. Poverty alone is a risk for our kids entering school not ready to learn. And we also have child care centers that are connected to our preschools. We have a program where we actually train other child care providers to improve the quality of their own child care centers. And then we have our treatment arm where we do mental health and substance abuse treatment services for all ages, and from kind of more mild all the way through severe emotional disturbances for adolescents. So like you said, we like to say we do most things. We also do foster care and adoption. So we touch a little bit of everything. We're a true safety net agency. So not just a nonprofit, but we're the ones out here really creating, across the pandemic, but just over time, the safety net for our community. When people need services the most, we're typically one of those agencies they turn to.
Wow, Jaimie, you guys do so much, and there are so many things I want to ask you, but if we can kind of start with Child Abuse Prevention Month.
Yep.
Are you seeing more calls for help right now? Because I wonder about those kids that are falling through the cracks, because we do know teachers a lot of times are on the front lines of being able to identify abuse.
Right. So it's such a conundrum. Domestic violence calls are up. They're through the roof. People are stuck home with their, abuser. Child abuse calls are down about 50%.
Wow.
So I always say to my staff, I'm in this very strange situation because we do foster care and adoption. I have a budget like everybody else, and it's set on having a number of kids in foster care. We're 40 kids below what we typically have in foster care on any given day.
Why is that? Do you think?
Kids are not in school. So if you think about who are the people reporting child abuse and neglect: teachers, pediatrician, family, friends, neighbors. Our kids are not seeing these people. So abuse and neglect is not being found and identified in the same way. It's not an adult victim of abuse who's calling for help. Our kids end up being voiceless, or they only tell people they really, really trust, like a teacher or a school nurse or a counselor. So it's really disturbing. Calls are down to Child Protective Services about 50% right now through the pandemic. So we worry that we're not seeing the same number of kids. I don't by any means think that it means suddenly child abuse and neglect is not happening. And so I do think it's timely that Child Abuse Prevention Month is meant to raise awareness nationally about abuse and neglect, and educate people about the preventive factors that can help. And As an agency that does a ton around this, I'm hoping maybe some extra highlights on this, even if it's just a neighbor who sees a kid playing and notices bruises, will kind of do the right thing and help us be sure that we're catching those kids. I don't think any parent wakes up one day and says, today's a great day to abuse my kid.
Yeah.
It's what happens in between. It's poverty. It's intergenerational foster care issues. It's, a history of abuse. It's a lack of parent training and support. And there's so many factors that go into it. But if we're not finding those families and helping them, we're not helping the kids and we're not helping those parents. So it's disturbing.
And we also know stress is up right now, which can add to these situations. So you would think your calls would be even higher because there's so many new stress,
right.
Stress levels on families right now.
Yeah, so our calls overall for like mental health and substance abuse services have started to rebound a little bit. I think the last time I was here, you and I had talked about how we didn't see that onslaught that we keep hearing is coming, the mental health crisis from the pandemic. Some of that is because people were not ready to spend money on copays and deductibles for services with insurance. Some of it is people were in survival mode. We've seen that tick up a little bit more, people coming out, getting ready for therapy. I still think the issue around child abuse and neglect, the families you're talking about, those stressors, those families are not prone to reach out for help. They're pulled into the system. They don't push in for help. They get caught up in child welfare, criminal justice, other aspects of the system where we end up ultimately, hopefully, helping them and reuniting their family. If not, hopefully we can match kids for adoption. We always come in hoping parents can get their children back and we can match families. But they're not the ones reaching out for help. It's typically an external source that pushes that issue forward, that helps with child abuse and neglect. Now, having said that, we have a host of services like I was describing, where we do get calls from parents who are stressed. It's not necessarily like, hey, I'm abusing or neglecting my child. It's more families that are at risk of abusing or neglecting them, that they're living in a high stress, like you said, maybe they've lost their job or they're living in poverty, or we have a program just for babies that cry like 23 hours a day. Fussy babies are at very high risk for shaken baby syndrome. Parents can only take so much. So we do have a host of programs that we like to build up parents' skills, build resiliency, help parents support programs. They reach out some, but those are usually at the high end of prevention, which is where we want to catch families versus when they're already should be in the system, quote unquote, if that makes sense.
Jaimie Clayton with us here on the MegaCast. She's the president and CEO for Oakland Family Services. And with that, Jaimie, what should neighbors be looking out for? Because we're also at a time where we're trying to tell everyone be socially distant.
Correct. Right? So many mixed messages right now. Stick to yourself, yet go look at your neighbor's kids.
Yeah.
I think, especially now that the weather's breaking, if you see a child who doesn't look clean, doesn't look kept, doesn't look like they're eating, some of the real obvious signs, bruises. But then, hopefully with masking, maybe kids are talking to other kids. And so, we have to take the things children say to us really seriously. And sometimes they do tell, or they say they're scared, or they look nervous talking to people. You don't want to jump ahead, but it's okay if it looks like something's very different. And can it be stress around the pandemic? Sure. But I'm going to err on the side of asking the right questions versus ignoring if I see a child that just doesn't in my gut look right. Like the child doesn't look dressed for the right weather or is all covered up. Or again, you can tell if the child is eating, is being bathed, because it's not just abuse, it's neglect too. Especially I worry about these families who may not be working, may not be getting their benefits and so forth. And then I think if you have an opportunity to experience a child that is normally happy, carefree, and something seems off, it could be a host of things, but let's help with any of those. Is it just the stress of the pandemic, or is something going wrong at home? And asking the right question or reaching out to the right resources. Even if it's calling Child Protective Services, it's their job to investigate. not yours.
And so with that, Jaimie, too, because as we know that our teachers and pediatricians, they're trained to look for some of these signs.
Yeah.
Plus, a lot of times when you're involved with that kid on a pretty regular basis, it makes it easier to see some of these issues that are going on. But if I am a neighbor and our kids play together, and right now everyone's playing outside because of COVID, and you start to notice things, you notice a change, when do you know to try to have a conversation and not be that nosy neighbor, because you still have to live in the community with them, and when to try to seek help, or who should they call?
Yeah, it's a super delicate line, and there's no one answer. Every situation's a little different. I think you have to base it on your relationship, and you can do some just checking in. How you guys doing? Everything okay? Worried about all my friends and neighbors during the pandemic. Sometimes people will talk to you, and then it could be you refer them to a place like Oakland Family Services if they sound super stressed. Then it's our job to try to see if we see signs of abuse or neglect. We're mandated reporters, right? So it could be a different entree point where you're not trying to investigate, is there abuse, but maybe there's a stressor and you can just recommend they get some help. And that's an entree point for a child to find safety. I think if you really see signs, bruises, or you can tell the child is really unkept, something's really wrong, or you see the home is not safe, then you can, really you Google, Michigan Child Protective Services, and you're going to get a number to call for your county, and then the investigation's on them. And it can be anonymous. They're not going to share with the person that your neighbor reported you. They never do that. But you can also report anonymously. The most important thing is that somebody gets eyes on these kids if you're actually worried about them.
Jaimie Clayton with us here on the MegaCast. She's the president and CEO Oakland Family Services, and we are taking a moment to recognize this important conversation. It's so hard for so many of us to actually have at this point in time as well. But April is Child Abuse Prevention Month, and we do want to make sure that kids are not falling through the cracks right now because of the pandemic. And we know so many kids are remote learning, and we also know there are a lot of school districts that are losing track of some of these kids. And sadly, I remember a few years ago covering the horrific story out of Detroit where the lady had killed her kids and the daughter was in the freezer, and everyone kept saying, how was that possible? Right. Where were the schools? Where was this? Where was this? And, these kids can fall through the cracks, and I think even more so now in the middle of the pandemic. So we need to all work together because we are one community in this crisis. And with that, Jaimie, anything else that you want to touch on some of your other programs going on right now?
Yeah, all our programs are up and running. We're actually enrolling for summer programming at our child care centers, both in Pontiac and Walled Lake. You can call either office or Google us or www.oaklandfamilyservices.org. All of our programs, the ones we just mentioned, if somebody's interested in a home visiting program for parental support or they know somebody, and also mental health and substance abuse. So I would just encourage you, if you think you need help or you know somebody, to reach out. We likely have a program to help. I would also just like to plug our 100th, again, one more time. We have, unfortunately, we had to move our annual breakfast, which is our one big fundraising event, like everyone else, virtual on May 4th. So if you join us on social media, where you would hear stories of families that will say we saved their lives, and hear a lot more about our work. And then also it would offer you an opportunity to support Oakland Family Services if you're interested. And then also on social media or at the website, like I said, we're having a walk run on July 24th, a really fun family event to help celebrate our 100th anniversary. And then if everything goes well with vaccinations and COVID, like fingers crossed, we're going to have a culminating event, a big gala at Oakland Hills Country Club on September 24th to truly celebrate the 100th. I'm just hoping we're able to do that all together in person.
Fingers crossed. Jaimie Clayton with us here, President and CEO, Oakland Family Services. Please take time out to check out some of their services, even if you don't need them. we need to support programs such as yours in our community because you do so much work. So we want to say thank you, but also thank you to your team because I know you guys are working around the clock and it's stressful for everyone right now.
And I will share that. Thank you very much.